There's another thing that's on the horizon that's, I think, phenomenal, just mind-blowing. Heal thyself is an old passage. And what they're figuring out how to do is exactly that. There's a new process that is not controversial in stem cell therapy where we take the red cells from your own body, spin them down and get out the platelet-rich plasma, PRP is what it's commonly called. The platelet-rich plasma has many, many stem cells in it, and they're viable stem cells. You can do a variety of things to activate them even further with some adipose tissue or some bone marrow, a little bit more invasive than most people are comfortable with, but the platelet-rich plasma, the PRP, is phenomenal. You can actually get the joint to help to start reconstituting itself. If you spin them down, you take the platelet-rich plasma, you spin it again and make it pure platelet-rich plasma, have it placed perfectly, like you see in the brochure, in your knee, and your knee will help to start reconstituting itself. They're using it, well, I had told my colleagues, this is the harsh reality. When we find new type of treatments, what's the first thing we do? We try it on the animals. So they do animal testing. And what do they do next? They try it in the foreign countries. And after that, then if it's okay, they bring it here. But they're using some of the techniques that they're using for platelet-rich plasma would blow your mind. They revascularize a completely ischemic leg. Ischemic, where they were going to cut it off. And when they showed the images afterward, instead of two strings hanging down, it looked like the tentacles of a jellyfish, dozens, that from the revascularized leg. They're using it for Crohn's disease, COPD, arthritis, of course. They even have some of the patients that are with these neurologic surgeons that normally do the brain implants for Parkinson's patients. And instead of putting that deep brain stimulator, they're actually putting the platelet-rich plasma to help to reconstitute those specific cells.
And they stick it in the brain.
Yes. So they're using it for some amazing things. 1 second, and I'll get your question. We are offering the platelet-rich plasma to our patients. No! The insurance companies haven't caught up to us yet, and they don't pay for it. Although, with the time and money and effort that we put into many of the other treatments that we get, it adds up really fast. The big thing is it's not snake oil. It's proven to work. There are different varieties, different techniques, different ways you can tweak it for a tendon that's ruptured. You want more of an inflammatory response, whereas in a joint, you want as many viable stem cells as you can possibly get, but it has to be in the joint. So keep in mind, the orthopedic surgeons are great at what they do. They're trained with a knife, and I love them for that, because they're not trained with a needle. If you understand what I mean. So if you're trained with the needle, you know that it has consequences. You also know how to wield it judiciously so you get optimal, best results for each and every person, and try to avoid the knife at all costs.